Doc Discussions with Dr. Jason Edwards, brought to you by St. Luke's, St. Louis.
Welcome to Doc Discussions. I'm Jason Edwards, and this is, in my opinion, the world's best medical podcast where we have discussions with physicians to discover who they are and what they do. And I'm joined by my good friend, Dr. Pearl Phillip, an infectious disease doctor. Pearl, how you doing?
I'm well. Good to be here with you, Jason. Thanks for having me on your show.
You bet. And you know, I know you better than most of our guests because our daughters are friends,
Yes.
and we've been on several committees together.
Yes.
Yeah. And so I think we can kind of take this in many directions, but I want to first just kind of tell people like who you are as a person. And, you know, one of the things that I think about is I see you as a mother because your daughter and my daughter are good friends, and your husband is a physician and my wife is a physician. So, and we both have 2 kids. So we're kind of at the same place in life. Talk to me a little bit about that.
Yeah. You know, I thought being a doctor was hard until I had kids because there are no answers and they're so different. And I can't tell you the number of unread parenting books that I have on my bookshelf, each one prompted by another parental crisis that I've purchased. So that is a challenge. And, you know, I think that I recently read this article that my sister sent to me in The Atlantic, and it was talking about how parents need to be more like lighthouses as opposed to helicopters that go in and try to answer and solve and pick up their kids in the moment of crisis. And I can completely communicate where I am in life right now with this quick story. So my daughter, Aya, she started at a new school, and now she has to take the bus for the first time. She's 6 years old. And it's a good local public school. And, you know, I believe in public schools and I wanted to support this public school. So she's taking the bus and, you know, 2 weeks in, we have daily conversation. How's it going? Do you like the school? And she says, Mom, you have to give the school bad ratings. And I was like, oh, man, like this is not what I wanted to hear because she seems happy.
Yeah.
And I've talked to her teacher and she's adjusting, but there's something going on. And I'm like, I was probing further and she says, no one talks to me on the bus. And she hates taking the bus because she sits alone and everyone has established connections. So my mind was like, oh, I got this, you know, I'm going to say, in my mind, I was like, I'm going to give her 5 questions. She's going to have candy in her backpack. Once she's going to sit, she's going to bribe the kids with candy. And then she's going to pull out question 1, 2, 3, or 5. She's sure to start a conversation with her. I'm going in my mind with this. It's like, you know, I'm going to make her class president or whatever. She's going to be the most popular. And then I don't say anything though, because I just like, you know, we have a neighbor? Do you have conversations? And I just kind of let it go. Well, I did not enact plan A, B, or C, and she made a friend on the bus. And now her ratings of the school have gone up, you know, and she's okay. So I think it's this idea of like, you're probably in the same position I am where we do, you know, think, you know, have more than I think my parents certainly did. And we have, you know, that book on Amazon that you can buy or that toy or that thing that can solve the answer of the moment. But this idea of like letting kids figure stuff out on their own and having the patience to hear them out instead of problem solve for them has been a real challenge. And just to like kind of allow kids to be who they want to be, who they need to be, allow them the space to discover who they are. That's been a challenge for me, who seems to want to get in and solve the problem because I have the resources, I have the knowledge, and I got the answers. You know, so that has been challenging and humbling. And I, in many ways, and I think you appreciate this because our kids are similar in ages, like their innocence and unbiased opinion of the world and their ability to just call things as they are has been so revelatory and honest. Everything from about my eating habits, you know, like why I need to stuff those fries from McDonald's in my face when I'm also trying to lose weight. Like, do I need to indulge? To, I don't know, just observations about family members or whatever. It's really wonderful. And it's been a real fun journey.
Yeah. So I don't know if it's kind of like the people who go into medicine are people who like realize they're consequential and like put forth effort to like do this, or if like the journey from undergraduate, and you're a fraction of the people who said they were pre-med who actually get into medical school, and then you go through residency. But like everything me and you have ever known is like the work you put in is kind of linear correlation to like an outcome. But parenting's not really like that. And some things just take time, and some things just take patience, and some things take lack of action. And I think it's something that I see kind of in our generation of parents, that the solution has always been hard work. And as parents, we want to like do all this work to make things happen. And sometimes you just sit back and, you see your neighbor, sitting back on the, on the back patio, drinking Busch Light and smoking a cigarette, and their kid's doing great. And you're like, what's going on? And so some things will kind of work themselves out, and it's unclear in life, I think, what's good for us and what's bad for us. And sometimes being the lonely kid on the bus can make you sympathize with lonely kids later on when you're popular. And so it's weird how things kind of work themselves out. And I agree. I think our generation of parents, including me, want to do things to make things better.
I do. Something I'm learning slowly is that if I'm happy, my kids are going to be okay. You know, and so like it's not so much that I need to sacrifice everything, myself included, to be there for every possible need they could possibly have or anticipate. But if I can take care of myself, sleep well, you came and spoke to the residents at the faculty meeting about the importance of physician health and productivity. If I can be rested, healthy, or make good food choices, they're watching everything I do. They're watching how I talk to my husband, how we solve together, or shall we say, have heated discussions, and how we communicate, and how I talk about my friends or my neighbors. They're watching everything. So if I can have kind of clear values that I try to stay true to and live a life that I'm proud of in a way that I'm proud of, I think I'm slowly, in the hard way, appreciating that might be all that I really need to do, because those values will also be applied to how I parent.
I totally agree. I had this patient, and I'm going to get this wrong on the details, but he worked for some sort of camp that took boys who were having a really tough time or didn't have parents or something like that, but they lived in-house at this kind of rural camp, and he would try to rehabilitate the boys. That was the what their business or whatever it was did. And so I thought, well, maybe I could learn something from this guy. That's a good rule. Maybe you'll learn something from somebody you're talking to. So I said, what works? And he goes, well, you don't save them all, but it's spend a lot of time with them, because they watch what you do. They don't necessarily listen to what you say, but they watch what what you do and how you act. And that kind of resonated with me. And there's a ton of books out there, and a lot of it's probably good information, but I think most of the stuff we still kind of got to learn just by going through it and doing it, and we'll make mistakes, but kind of like doing the best we can.
And that's a lot.
And it's a lot, and we'll fail.
Sure.
At one of the Mitch Albom books, it may have been The 5 People You Meet in Heaven, I'm not sure. It said, kids are like a crystal glass. You will get fingerprints on them, but just don't shatter them. Yeah. And that kind of helps me realize, like, you're not going to be perfect, but just keep putting in the effort, and they'll get there.
Yeah. And it helps to have a partners on the same page too.
For sure. And I think your husband, who's a medical oncologist, Sean, I feel like he compliments you well too.
I think that's fair to say.
You guys are a good combination.
Yeah, and likewise for Alex and yourself. Yeah.
And so you're an infectious disease doctor. What piqued your interest in infectious disease during your training to make you kind of go down that road?
So that's an interesting question. I was on track to be, at one point, a diplomat. Like, I wanted to be like a Madeleine Albright, and that was
really.
That was the closest to being Oprah, because I think I thought she interviewed like kind of the job you're doing right now, Jason, talking to cool people. But then I thought, okay, I am interested in about the problems of the world. My parents are from South India. I have an understanding of or an appreciation for health inequities globally. Just having visited India with my parents, and so I wanted to be part of that bridge of like the haves and have-nots. That was like the idealist in me.
Sure.
So I thought, maybe development, global economics, or something like World Bank or something like that. But then it was a class in parasitology that kind of piqued my interest. Like this little mosquito, like decimated the economy of like so many African countries, and I was like, what is this about? And so I got interested in global health, and so. Anyway, long story short, I ended up working in the Office of Global Health and was on track to be. And I was in this like something called like the Emerging Leaders Program.
And this is in DC?
Mm-hmm. Yeah, so it was like a track to be in management and government.
Okay.
And so I worked at the CDC. That's where I was positioned in the Global AIDS Program. And so I was doing contracts and HR, and I was a country officer during PEPFAR, the President's Emergency Plan for AIDS Relief. And so I helped manage communications between headquarters in Atlanta with the countries that I was responsible for. But I always felt like the outside looking in on these scientists, physician scientists who were making decisions about treatment and protocols for HIV. And I would have the opportunity to visit some of these countries, and I could see how this antiretroviral therapy changed lives of millions of people, giving them hope.
Yeah.
And it sounds, cliche or whatever, but this simple idea that why would you get tested to understand your diagnosis if you had no options for treatment? You wouldn't, right? It was just a death sentence. You were, now it's a confirmed death sentence. But once you had a treatment option that was affordable and available, you would get tested. And now you can start thinking about having a family and living a life and being healthy.
Yeah.
And I saw that firsthand in various contexts. And that was like, okay, I want in on this, and I want to be at the table. So I went to medical school because of that experience.
Really?
And then that has always been on the back of my mind. And so in residency, the other interest I had was obesity, actually, because in a residency clinic, I think I did a study where 1 out of 2 patients in our residency clinic was obese. And I thought, why are we not talking about obesity?
Yeah.
But at that time, the miracle of that Ozempic, et cetera, is, we didn't really have affordable ways. And I thought I could, be part of this treatment world of like HIV and global health, or I could bang my head against the wall and help try to get patients to lose weight. Not to say that Ozempic is the answer. I mean, it's much more complicated than that. But so I had another fork in the road. And I really do think that it was mentorship in residency. I had a mentor who worked for the CDC, and she was the head of epidemiology in our hospital. And she really encouraged me to go into ID. And I thought, this is like the path I'm on. But, I think an interest of yours is also health and wellness and food choices. That's always been another interest of mine. But I forget your question. Like, how did you get into
and so,
ID?
I mean, that's fascinating.
So that's what I ended up, and how I ended up
and you kind of say it nonchalant, but I mean, like, this is like an awesome experience to go through that so few people, much less physicians, have a chance to kind of be involved in that side of it. And so super fascinating. Did you ever meet Bono at any point during this?
You know who has is Dr. Campbell.
Really?
And he didn't even know who Bono was. And so that's the hilarious thing about this story.
He's like, get out of my way, sir.
Right. So he had a friend, who I think it was I think Bono performed for his special, very well-to-do friend's birthday party, and
oh my gosh,
and Bono had to be pointed out to him. So.
But that's a super fascinating thing to go through. And so, do you feel like that experience helped you at all? So you're right out of training, and then COVID kind of hit. And do you feel like any of that kind of other life like helped you deal with your role? And because you and Dr. Campbell and other doctors were in infectious diseases here, and kind of had a big role in our COVID response at the hospital. Or just how was that for you?
I mean, it's funny. Dr. Campbell and I speak about this a lot. For him, it was in the early 80s. This disease that was affecting initially, the gay population in San Francisco, when the first MMWR came out. And he treated these patients. There was a lot of stigma against them. It was not clear how it was transmitted. And there was a lot of fear, I think, was the prominent emotion dictating the times at during that era. similarly for us, when COVID first came out, I remember we did a grand rounds, and I think there was like one article in the New England Journal as opposed to every other article.
Yeah.
But we didn't know. People were dying here in the hospital. I remember talking to one patient who said he didn't have time to stay in the hospital. Well, he left in a body bag, unfortunately. So much mortality, because initially we didn't have anything. This was a naive population, right?
Mm-hmm.
And so fear was, I don't know if you washed your groceries or your Amazon packages. That was the predominant emotion. So I think that was very much a peril. And then it was, trying to understand anecdotal evidence, right?
Yeah.
Because it was like case reports and what treatments are working and what transmission protocols we have to follow, isolation protocols, versus clinging to whatever scientific data that was established with evidence, like significant, real, truly scientific facts that we could base our treatment protocols on. So kind of flying by the seat of our pants and talking to others and, looking at discussion boards and grabbing onto whatever kind of, ivermectin, for example. We remember all the crazes that we went through, and always trying to stick to what's working for us. What is the true evidence here versus anecdotal evidence, and what do we find is working in our experience, and what can we do? So I think that was an exciting time for me as a ID attending 1 year into this whole thing in a new hospital. But it was, as terrible as it was, like I wouldn't have traded it for anything, because it really connected me to our hospital in terms, everyone from housekeeping to, like the head of whatever department, pharmacy, respiratory, nursing, et cetera. It brought people together, in a very incredible way. And then, of course, to see the role that the COVID vaccine has played has just been phenomenal. And that's how it doesn't peril the HIV crisis,
Yeah.
Welcome back to Doc Discussions with Dr. Jason Edwards. Medical news you can use, no appointment necessary.
So now, okay, so this is going out, the podcast is, and I think, COVID in general can be kind of a polarizing topic.
Yeah, unfortunately.
And sometimes I hear people say this, and I don't want this to be like a whole COVID thing, but I want to get kind of your take on this. Mm-hmm. Currently, if you get COVID, mm-hmm. This, and tell me if I'm wrong, because I'm not an expert on this, but like this, I think the CDC says that like kind of treat it kind of like the flu currently, like the normal flu. And so, and I think some people mistakenly, and maybe a lot of people do, but some people mistakenly think that it's like always been the flu. Mm-mm, but it was much, its mortality rate was much higher initially.
For sure.
And then over time, people have gained natural immunity mm-hmm. and immunity through vaccines. Right. And also the virus has weakened over time. Mm-hmm. Is that accurate?
Yeah. It has always remained... it always been and still remains more infectious than influenza.
And so you can get it easier.
You can get it easier.
Yeah.
And unlike influenza, it doesn't have the component of long COVID that we're seeing, which affects, we think, 10% or so of COVID infections. And we know now, and there's data that just came out, that vaccination cuts that risk of long COVID by half. So, as unfortunately, as political as this has become, you can't argue with data. Now we have millions of individuals who have been infected. So we have evidence, whereas 2 or 3 years ago, we just had hunches.
Yeah. Yeah. So, I remember initially, mm-hmm. like we were relying, because my wife was an ICU doctor at the mm-hmm. time. And like, you were kind of relying on texts from your friends who are like in Boston or New York or Chicago. Yes. And that's like, that's all you had, but you had to kind of like trust what they were seeing. Mm-hmm. It was kind of like the best you had, but mm-hmm. over time, there's been research articles based off studies where they compare this treatment versus that. One thing, there's a website I follow called Retraction Watch, and there have been a fair amount of COVID studies that have issued retractions for but it's still a I think less than 1%. But that's something that's some people will say like the science. There's some bias in the science, and scientists are humans, and they do have biases, and so you will find some of that in the data. But it's important to remember that they were kind of rushing to get these papers out is one thing, and it's still a small percentage because a lot of scientific papers have been published on COVID, and so but I hear some people kind of maybe not realize that the magnitude that the virus how sick it made people was much more earlier on than it is now for kind of a lot of reasons.
Yeah, exactly. And I think that was extraordinary to me, especially the older. And we found that age is a huge predictor of morbidity and mortality. But older patients who would come in, most of the times they would not make it. Yeah. Whereas now it's just an annoyance to be here in the hospital.
Kind of like the old flu, right?
Absolutely.
And some people would die of the flu virus, and still do. In 2015. And some people can get very sick and unfortunately die from the current COVID. I understand people not wanting to kind of lament on it and kind of like move on. But I do, like, when you don't know, it's pretty scary. Yeah. And it's like, having to go into the hospital. It was tough. And,
Jason, I think thinking back upon it, our concern was not so much the kids. It was exposure to Sean's parents.
Okay.
Because they're a big part of our lives. And I think it was the age. And I'm trying to think back to it. Like, what was really the driving concern there?
Yeah.
I think it was the kids would get sick and they would give it to the grandparents.
Yeah, I think we had a lot of that too.
So that's where
our situation is very similar.
Yeah.
Okay. And so you're a mother, a former diplomat of sorts,
a wannabe,
and an infectious disease doctor, and a big part of our hospital too. And the other thing is, do you read a lot? I get the sense that you read a lot in all your spare time.
I will. I'm glad you brought that up because I was actually an English major.
Really?
As an undergrad, English molecular bio. And I have always loved English, but
can I tell you something real quick? Sorry to interrupt.
No.
When I applied for my job and they asked me how many languages I spoke, I said almost one. So anyway, okay, that's a joke. Okay, go ahead.
So I'll tell you something that has been really enjoyable over the last year is that we started a book club.
Really?
And I'll tell you, it's probably the reason I ended up marrying Sean, because when I was working at the CDC, we had a book club there, and it was mostly fiction, right? And in our first year of medical school, we both met at Tulane, and after the first exam, everyone goes to drink beer. I think that's maybe all medical schools, not just especially in New Orleans, right? And so we're talking, and I say something like, "Man, I just missed this book club that was part of it. It was like such a fun part of my life." And he's like, "Interesting." And so then he went home and he collected like a bunch of short stories, and within like 2 days, he sent out a collection of short stories because nobody who can read a novel, but everybody can read a short story. And he says, "We're having our first book club. Meet at our house, at my house or whatever." And so thus was born a book club throughout all of medical school.
So did he, was it like love at first sight for him? And this was like the key to your heart, or was that just him spontaneously?
Also, he was also the lead singer in the moderator band. Get it? Haha. So there were a lot of things that was going. So that's another story for another podcast,
okay.
But that was definitely a huge thing. Anyway, so we have continued that with some friends here over the last year or two, and we rotate selections, and it has opened up so many worlds and emotions and forged like connections and friendships, and it's been such a fun thing. And thanks to Audible, it's possible. It's amazing how much of a book you can get through packing lunches and making breakfast for your
and just
kids
your commute
in the morning and
to
commute.
and from.
I know, walks, whatever it is, putting groceries away. But it's been a really nice, I don't know, aspect of my day-to-day life is just to, right now I'm reading Demon Copperhead.
What's that about?
Oh my gosh, so depressing. But it's about a kid in foster care. Oh, sorry. It's a kid in foster care that is going through the system and born to a drug-addicted mother.
True story or fiction?
I think it's fiction, but
Okay.
it's by Barbara Kingsolver, who also wrote The Poisonwood Bible. I don't know if you've read that book.
I have not.
She's a masterful writer. But the heartache of drug addiction, and the statistics with the opioid crisis are just mind-boggling and so soul-sucking. But this is, it takes you right there through the eyes of a child growing up in the foster care system to a drug-addicted mom, and what's that like? And I've heard it's not a happy book, but everyone who's already completed the book for this month in our book club has said it was an amazing read. And so,
what's the setting? Where are they at in the book? Do you remember?
I think they are in like a small town. You mean a city?
Yeah, or state?
There's something there's a mention of New Jersey.
Okay. Okay.
So, I think it's like
the reason I ask, I used to work in Kentucky, and the opioid crisis is kind of really started in Appalachia. Whether it's West Virginia or Eastern Kentucky or Western Virginia.
Okay.
And so, but up into Pennsylvania and Ohio too. But and we actually did a podcast, on this previously. But you would see it all the time. It was something like 1 in 10 children in Appalachia live with their grandparents because their parents have passed away from opioid crisis or are in jail. And so we actually don't see a lot of that here in Chesterfield, which is kind of a more affluent part of town. But you would see the real life ramifications and what that does. And it's thank God for grandparents because they were kind of the saviors, with what I saw. But certainly it's a tough go. I'm a big fan of John Prine, who's a singer who actually passed away during COVID. But he's got an excellent song that has a video on it called Summer's End. And I don't know if it was shot in Kentucky, but it looks like it, and it looks, and I think they don't explicitly say it, but watching the video, I think that the song's about opioid crisis and the loss of parents due to drugs. But it's tough stuff. But I think that honestly is probably, as healthcare providers, is probably one of the most important conversations we can talk about is the impact of the opiate crisis, because the mortality, I might be wrong on the numbers, but like car fatalities are like 40,000 a year ish. Opioids, it's above 100,000 now. And so that's a big problem. And
there's a huge jump recently. There's an article in the New England Journal that the residents reviewed at a journal club. It's jumped astronomically since the COVID crisis and peaked during the COVID crisis. And I think there have been a lot of interventions that have tried to stem the numbers. But I think it comes down to socioeconomics, which is so hard. What role? How can we change that? What role do we have to play? But these are deep-seated issues.
Yeah,
right?
For every complex problem, there's a simpler answer that's wrong, and it's a really, really tough problem, and it probably needs to be attacked on multiple levels.
Absolutely.
And to be honest, it doesn't feel like it's being attacked on any level.
Yeah.
And so
I see it with unfortunately with infections, soft tissue endocarditis, and so And I trained in North Philly, and so I saw it a lot. And I'm so paranoid about my kids getting it. Your mind will, taking it back to the kids. And so you can imagine what our dinner conversations are like when I talk about, this pus coming out of a joint and aspirating it. And because this person is shot up and, Sean's like, is that really necessary right now? Yeah. And I'm like, they need to know. So I need to probably tone it down a little, but it's a scary reality because
people losing their hands because of septic emboli,
multiple heart valves.
I remember I did a rotational cardiothoracic surgery, and I remember the surgeon, telling these young young guys who are, a lot of them worked in the coal mines, but a lot of good people work in the coal mines. But it was, but he would say your disease isn't your heart valve, it's your addiction, and it's up to you to fix it, and it's a tough problem. I think they're making some improvement with the doctors prescribing opiates, but but that's kind of, I think, less the issue now, and it's the synthetic fentanyl or the synthetic opiates that are coming over from China and coming through the border at Mexico, which is, I think, currently the biggest problem. But it's I'm not going to be shy about kind of beating the drum on that, because we need more and more people talking about that, and it's 100%. It's a real issue. And I know people personally who've been affected by it, and so it's a very sad thing, but. It's up to people like me and you, and making our voices heard and kind of, being a bellwether and saying, this is a problem.
Yeah. I mean, I think it starts with caring, right? It starts with caring. And I think, just taking it back to this book, is trying to walk someone's reality, right? To something that we talk about with residents is like, can you create empathy? Can empathy be taught? I mean, that's another question I think about too. Like, can you teach your kids to care? And I don't know. Do you? How would you answer that question?
Well, we empathize with nobody as much as we do our former selves. And so, like, you're on the bus and you're all alone, and you kind of, then your daughter, she makes friends, and she's not that person anymore, but she looks back and kind of sympathizes with her former self. And then when she sees somebody else on the bus and alone, it makes you think, hey, I've been there, and that's not fun, and maybe I should just go say hi. And so, then this is something Lisa Ryan and I talked about. It's like getting the kids out of the house, getting them dealing with people. I feel like video games and stuff like that are probably not going to help with the empathy. Nothing wrong with like a kind of a moderate amount of video games, but like human interaction, I think, is probably going down overall with the youth, and I don't know if that's going to make them more empathetic.
And it used to be that books, when kids read books, I feel like I'm empathizing with a character in this book that I'm reading. Yeah. But I agree with that. Yeah. Yeah. Well,
I think you and I could talk forever, but I really appreciate you coming on today.
Jason.
Yeah.
Thank you so much.
And so to the listeners, please tune in next week for our next episode of Doc Discussions. I want to thank our producer, Kelly Webb-Little, and Mr. Todd Perkins on sound. Thanks for everything you do. We appreciate you.
Thank you for joining us for this episode of Doc Discussions with Dr. Jason Edwards. Be sure to check out our other episodes and tell your friends.